Most people believe a failing heart always announces itself with a dramatic chest pain, the kind you see in movies, where someone suddenly clutches their chest and collapses. But for millions of older adults, heart failure doesn't arrive with a bang. It creeps in quietly, disguised as tiredness, a little swelling, or a cough that just won't go away. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you notice any of the signs we're about to cover, it may be helpful to speak with a healthcare professional who knows your history. Here's something worth sitting with before we go any further. One of the signs on this list is so easy to dismiss, so easy to blame on getting older, that many people live with it for months before anyone connects it to the heart. We'll get to that one a little later, and when we do, you may find yourself thinking back to a moment you'd almost forgotten. Heart failure doesn't mean the heart has stopped working. It means the heart is struggling to pump blood as efficiently as it once did, and the rest of the body starts sending out small distress signals in response. Those signals can be subtle at first. They can look like normal aging. That's exactly why so many cases go unnoticed until they become serious. And it's exactly why we're spending the next several minutes walking through each one carefully, in plain language, without the medical jargon that so often makes this topic feel intimidating. Unusual fatigue that doesn't improve with rest. There's a difference between the tiredness that comes from a long day and the kind of fatigue that lingers no matter how much sleep you get. When the heart isn't pumping blood efficiently, muscles and organs receive less oxygen than they need. The body compensates by conserving energy wherever it can, and the result often feels like walking through mud. Simple tasks that used to take no thought at all, folding laundry, making a bed, walking to the mailbox, suddenly require a kind of effort that feels disproportionate. Take Margaret, a 74-year-old retired schoolteacher from Ohio. She used to spend her mornings gardening for an hour or more without a second thought. Over a few months, she found herself needing to sit down after just 10 minutes, blaming it on the summer heat or simply getting older. It wasn't until her daughter noticed she seemed short of breath even while resting on the porch that Margaret mentioned it to her doctor. Stories like hers are common because fatigue is so easy to explain away. This kind of tiredness may be associated with reduced blood flow to the muscles, and it's often one of the earliest signs the body offers, long before anything shows up on a routine checkup. The key difference to pay attention to is persistence. Ordinary tiredness responds to rest. This kind often doesn't. Swelling in the legs, ankles, or feet. When the heart struggles to pump effectively, blood can back up in the veins, causing fluid to leak into surrounding tissue. This often shows up first in the lower body, simply because gravity pulls that fluid downward throughout the day. You might notice your socks leaving deep indentations in your skin by evening, or shoes that fit perfectly in the morning feeling tight by afternoon. This kind of swelling, known in medical terms as edema, meaning a buildup of fluid in the body's tissues, tends to be symmetrical, affecting both legs rather than just one. It may also come with a feeling of heaviness or tightness in the skin. Some people press a finger gently into the swollen area and notice the indentation lingers for several seconds afterward, a sign doctors sometimes look for during an examination. It's worth noting that swelling can have many causes that have nothing to do with the heart, including standing for long periods, certain medications, or issues with the kidneys. That's exactly why it's not something to self-diagnose. If swelling becomes a regular pattern rather than an occasional inconvenience, it may be worth discussing with a healthcare professional, especially when it appears alongside other signs on this list. Shortness of breath during everyday activities. Breathlessness that shows up during activities that never used to cause it, climbing a single flight of stairs, carrying groceries in from the car, or even lying flat in bed, can be one of the more noticeable signs of a heart that isn't pumping as efficiently as it should. When circulation slows down, fluid can accumulate in and around the lungs, making it harder for oxygen to move where it needs to go. This sensation is sometimes described as feeling like you can't quite catch a full breath, even when you're not exerting yourself. Consider Harold, an 81-year-old veteran who prided himself on never missing his evening walk. He began noticing that he needed to pause halfway through, something he brushed off as simply slowing down with age. What caught his family's attention was different. Harold started needing an extra pillow at night just to breathe comfortably while lying down, a pattern that had crept in so gradually he hadn't thought to mention it. This particular version, difficulty breathing while lying flat, has a specific medical term, orthopnea, which simply means breathlessness that improves when sitting upright. It may be associated with fluid shifting toward the chest when a person reclines. If you or someone you love has quietly started sleeping propped up on extra pillows without really talking about why, that pattern alone may be worth mentioning at a checkup. A persistent cough or wheezing that won't clear up. A cough that lingers for weeks, especially one that produces a white or pink-tinged mucus, may be connected to fluid building up in the lungs rather than a simple cold or seasonal allergy. This happens because when the heart isn't circulating blood effectively, pressure can build in the blood vessels of the lungs, allowing fluid to seep into the lung tissue itself. The result can sound a lot like a common respiratory illness, which is part of why this sign so often gets misread. This is the sign we mentioned earlier, the one so easily mistaken for something ordinary. Many older adults and even their doctors at first glance attribute a lingering cough to allergies, a mild cold, or simply the dry air of winter. It's rarely the first thing anyone thinks of when they hear the word heart. But when a cough sticks around for more than a few weeks, worsens when lying down, or comes with a wheezing sound during breathing, it may be worth looking at the bigger picture rather than reaching for cough syrup and waiting it out. Think of Dorothy, 69 years old, who spent nearly 2 months convinced she had a stubborn case of bronchitis. She tried 3 different over-the-counter remedies before her son, a nurse, asked her to describe the cough in detail. The color and texture of what she was coughing up, along with the fact that it worsened the moment she lay down at night, prompted him to suggest she see her physician sooner rather than later. It's a small detail, easy to overlook, but sometimes the smallest details carry the most important information. Rapid or irregular heartbeats. A heart that is struggling to keep up with the body's demands sometimes tries to compensate by beating faster or less rhythmically than usual. This can feel like fluttering in the chest, a sensation of skipped beats, or a heartbeat that seems to race even during quiet moments like sitting and reading. In medical terms, this is often referred to as palpitations, which simply means an unusual awareness of your own heartbeat. It's important to understand that occasional palpitations happen to almost everyone at some point and are frequently harmless, often triggered by caffeine, stress, or dehydration. What may be worth paying closer attention to is a pattern that repeats often, lasts for extended periods, or comes with other signs from this list, such as fatigue or shortness of breath. When the heart's rhythm becomes consistently irregular, it may reduce the efficiency of blood flow throughout the body, which can, over time, be connected to the broader picture of heart function. If you've noticed yourself becoming unusually aware of your heartbeat, especially at rest, it can be helpful to mention this clearly to a healthcare provider, including details like how often it happens, how long it lasts, and what you were doing when it started. These details often help clinicians figure out what's going on far more quickly than a vague description alone. Sudden weight gain from fluid retention. This sign often catches people off guard because it has nothing to do with diet or appetite. When the body retains excess fluid due to reduced heart efficiency, the scale can show a noticeable increase over just a few days, sometimes as much as 2 to 3 pounds overnight without any change in eating habits. This is different from gradual weight gain over months. It tends to happen quickly and can fluctuate in ways that feel unpredictable. Many cardiologists actually recommend that patients with known heart conditions weigh themselves daily at the same time each morning, specifically to catch this kind of sudden fluid shift early. A rapid increase can sometimes appear before other visible signs like swelling become obvious, making it one of the more useful early indicators when tracked consistently over time. Frank, a 77-year-old retired mechanic, started noticing his wedding ring felt tighter than usual, along with a few pounds appearing on the scale within a single week. He hadn't changed anything about his meals. It was his wife, tracking his weight out of habit after his last hospital visit years earlier, who caught the pattern and encouraged him to call his doctor before the weekend. That small habit, a scale by the bathroom sink and a notepad nearby, has become something many families rely on for peace of mind. Difficulty concentrating or increased confusion. This sign tends to surprise people the most because we don't naturally connect brain function with heart function. Yet the two are deeply linked. When blood flow to the brain decreases even slightly, it can affect concentration, memory, and overall mental clarity. Family members sometimes notice this before the individual does, describing a loved one as seeming more forgetful, more easily distracted, or slower to follow a conversation than they used to be. It's worth being careful here, because confusion and memory changes have many possible causes, ranging from medication side effects to other health conditions entirely unrelated to the heart. This is not meant to suggest that every moment of forgetfulness points toward heart failure. Rather, When this kind of mental fog appears alongside physical signs like fatigue, swelling, or shortness of breath, it may add another piece to a larger picture that's worth discussing with a professional who can look at the full context. Aliner's family described it as her personality dimming slightly, not dramatically, just enough that people who knew her well could tell something was different. She seemed to lose her train of thought more often during dinner conversations. It turned out to be one of several signs that together painted a clearer picture for her physician than any single symptom could have on its own. Loss of appetite or a feeling of fullness. The eighth and final sign we're covering today often gets mistaken for a simple loss of interest in food that comes with aging. When circulation slows, blood flow to the digestive system can decrease, and fluid can also build up around the abdomen and liver. Both of these changes can create an early sensation of fullness, sometimes even nausea, making a normal-sized meal feel like far too much. This can be particularly tricky to notice in seniors who already eat smaller portions or have naturally reduced appetites. Family members might simply assume their loved one is eating less because they're less active, without realizing there may be a physical cause behind it. Over time, this can contribute to unintentional weight loss in the abdomen and limbs, even while fluid retention causes weight gain elsewhere in the body, a confusing combination that can mask what's actually happening. Recognizing this sign often requires paying attention over time rather than in a single moment. If a loved one who once cleared their plate now leaves most meals unfinished, and this pattern continues for weeks rather than days, it may be worth bringing up during their next medical appointment, particularly if it appears alongside any of the other 7 signs we've discussed. Heart failure rarely announces itself all at once. It tends to arrive as a collection of small, easy-to-dismiss changes: unusual tiredness, a bit of swelling, a cough that lingers, a heartbeat that feels different, a few unexpected pounds on the scale, a little more forgetfulness than usual, and a smaller appetite. Individually, each one can be explained away by ordinary aging. Together, they may tell a very different story, and that's precisely why awareness matters so much, especially for families caring for older loved ones who may not think to connect these dots on their own. According to research published by the American Heart Association, more than 6 million adults in the United States are currently living with heart failure, and that number is expected to keep rising as the population ages. It's a striking figure, but it also carries a hopeful message. Many cases, when identified early, can be managed effectively with the guidance of a healthcare professional, allowing people to continue living full, active lives. If anything in this video reminded you of yourself or someone you love, we genuinely encourage you to bring it up at your next doctor's visit, even if it feels like a small or silly thing to mention. Sometimes the smallest observations turn out to matter the most. We'd love to hear from you in the comments. Has anyone in your family experienced one of these signs without realizing what it might mean at the time? Sharing your story could help someone else recognize the same pattern in their own life. If you found this information valuable, please consider sharing it with someone who might need to hear it, and subscribe to our channel for more clear, honest, and carefully researched health education made especially for seniors and the families who care for them. Thank you so much for watching, and we'll see you in the next video.